Thank you. It is a huge honor for the both of us to be given the opportunity to describe what we think is an important FDA Health Canada approved clinical tool that is currently not available for patients in British Columbia. Before I begin, here are my conflict of interest disclosures. I was a former employee for CTF Systems, an MEG manufacturer. I spent about 10 years there in the 1990s. I continue to consult for CTF. I'm also one of two national co-chairs for the Canadian MEG Consortium, which sees membership that spans each of the Canadian MEG centers. I'm also an enthusiastic proponent of MEG technology. You're probably familiar with MRI and CT, which measures brain structure. So here's an example of an MRI scan, which you may be familiar with. And here is an example of a CT scan, which you may be familiar with. Equally important, however, is to be able to measure brain function. You may be familiar with brain function imaging technologies such as PET or positron emission tomography, and fMRI or functional magnetic resonance imaging, or FNIRS, or functional near infrared spectroscopy. These imaging technologies measure brain function, but indirectly by looking at some kind of metabolic effect. MEG and EEG, on the other hand, measure brain function directly. And amongst the existing technologies for functional brain imaging, MEG uniquely can tell you where and when the brain activity is occurring at the speed of thought. So what is MEG? Well, MEG stands for magnetoencephalography. That's a mouthful. It turns out that your brain produces electromagnetic signals. When you think, neurons create currents. And in this cartoon shown here, I'm showing a current in red. And this red arrow represents a bundle of neurons firing. And this bundle, for example, could represent normal brain function, such as hearing a sound, or looking at a picture, or understanding words. But this bundle of neurons could also be activated and be location of irritative tissue that may be the cause of a seizure. These currents move to the scalp surface and can be measured using something called EEG, which you're probably familiar with. And this is the standard approach that is used in hospitals to help find where a seizure may be occurring. If you've ever had an EEG, however, you might not find it a very fun procedure. I certainly don't. It involves using sandpaper-like pads to abrade the scalp. Then you paste electrodes on, and then through these electrodes, you measure the potential differences which are picked up. And this is how EEG works. On the other hand, there is an actually easier way of doing this using something called MEG. And just for those of you who have taken a basic physics class, you may know that electric currents produced here in the red produce not only an electric field, but also a magnetic field. And these magnetic fields produced by the neurons are really, really small, 9 to 10 times smaller than the Earth's field. And you know that you can measure the Earth's field by using a compass. It tells you where north is, which is giving you an idea of what the direction of the field produced by the Earth, or the magnetic field produced by the Earth. Well, you can think of MEG like a compass for the brain. It is capable of measuring the very, very tiny magnetic fields that are generated by the neurons in your brain. If you're interested in learning more about how this is done, I recommend that you Google superconducting quantum interference device, or SQUID, SQUID for short. Currently, commercially available MEG devices uses superconducting principles to achieve the sensitivity needed to detect the tiny magnetic fields coming from your brain. In this diagram, shown here, The green circles represent the magnetic fields that propagate to the surface and beyond, and is picked up by MEG device, the MEG device. The black lines shown here are the electric currents that propagate to the surface onto the scalp, which is picked up by the EEG. This picture shows you this picture here shows you a conventional MEG system, a device that you might find in labs. It's basically a dewar filled with liquid helium with it is basically a dewar filled with liquid helium with very sensitive hardware that operates at superconducting temperatures. When you place a person's head within the helmet-shaped region, you immediately see brain activity. There's no other preparation that's needed. There are up to 300 MEG channels that surround this person's head when you put the head inside the device. So imagine having to do this now with 300 EEG electrodes. That's a large and hard process, not fun for either the technologist or the patient. But with MEG, you can measure many, many more places around the head than you can with EEG. And this might help you better pinpoint locations where the brain activity might be useful, such as where epilepsy may be occurring. And so this diagram here then shows you an example of what you might see when you place your head inside an MEG system. In this example, what we're measuring or showing is someone's eyes moving back and forth. And when his eyes moves back and forth, and his visual area resets. And what you're seeing is his visual area being reactivated every time his eyes moves back and forth. And the visual area or visual cortex is actually in the back of the brain. And this is shown here in this sort of patch that's being activated when the eyes are moving back and forth. This, I think, really nicely illustrates the fast timing of MEG, that it is actually activated and able to detect information from the brain at the speed of thought, as well as its capability of finding the location of where something is happening. MEG is safe for all ages and abilities. MEG is non-invasive and painless. It does not use radiation, large magnetic fields, or injections. MEG is quiet and rarely causes claustrophobia. This means that it is very user-friendly, very friendly to all kinds of populations, special populations, people with disability, infants, children, the elderly. So it's very user-friendly in terms of being able to be scanned using an MEG device. So it's a little known fact probably that BC was actually involved in the commercialization of MEG and continues to be a world leader in commercial MEG devices. BC and SFU's pioneering work in MEG began in the 1970s. The work with MEG led to SFU's first spin-off company, CTF Systems, which is still located in Coquitlam, British Columbia, 30 years later. This artist rendition and photo shows an early design of a single channel biomagnetometer manufactured at CTF. You can probably tell by the hairstyles of the scientists in this photo that was probably taken in the 1980s. And in those early days, in order to measure different parts of the brain, the experiment had to be repeated over and over again by moving the device to different parts of the head surface. And this was a really laborious procedure and eventually led to the design of multi-channel units, which allows you to measure more than one location at the same time. One of the first whole head systems in the world was actually created here in British Columbia in the 1990s by CTF. And one of the first whole head systems was also installed at Simon Fraser University. This picture here, dated in 1994, shows Dr. or Professor Hal Weinberg's lab in Discovery Park and the 64-channel MEG system that was installed at the time in that location. The diagrams or the photos below depict the CTF factory in Coquitlam at various times in its existence. And to the right is another MEG system that was installed at the Down Syndrome Research Foundation in the early 2000s. One of the first systems that was sold by CTF was sold to a Dr. Nobukazu Nakasato for a hospital in Japan. And Dr. Nakasato wanted to see if MEG could be used to locate epileptic seizure onset zones. Through his work and other pioneers like him, MEG has been shown to be helpful in surgical decisions. Now, this complicated diagram illustrates, which I'm not going to describe, I just wanted to show it to give you an idea of the rich and multi-dimensionality that can be extracted from the MEG data. Not only can you find out where and when the brain activity is occurring, but the MEG also allows you to probe how the brain is connected and whether any of the networks are disrupted. MEG is used in research in areas such as autism, concussion, and PTSD. And it may be also helpful potentially in assessing conditions such as depression. In basic brain science, MEG is used to learn about how our brain works, such as how we process language. In the last 30 years since the introduction of MEG, whole head MEG, it has been added to many clinical epilepsy programs around the world. MEG is currently available in BC only as a research tool. We'd like to change that and need your help to make this happen. I will now pass the floor to Dr. Clarke, who will show you why it's time to add MEG in British Columbia as a clinical tool. Thank you.
Okay, so over 65 million people around the world suffer with epilepsy. And 1/3 of those people have seizures which are resistant to medication, meaning that medication doesn't help improve or treat seizures. So for these people, surgery can be a very effective treatment, and in some cases, it can also be an effective cure. But it is typically underused. And the reason it's underused is because of the challenges of accurately identifying the specific brain networks involved in seizures in order to appropriately plan surgery. So successful epilepsy surgery relies on being able to measure two things: the neural processes in the brain that cause seizures, and also being able to localize where in the brain the seizures are coming from. So currently, this is most commonly done by implanting electrodes on the surface of the brain. So this is obviously a very invasive technique. It requires opening the skull and placing an array of electrodes on the surface of the brain. This is also a very expensive technique, and typically patients have to stay in the hospital to be monitored for days or weeks after the implantation of the electrodes. It also has other limitations because it only enables a small number of brain regions to be monitored at a time. So generally the array of electrodes is a restricted size, and it's placed over specific regions in the brain of interest, and we're not able to measure from the whole brain at once. So MEG can be used as a non-invasive tool to replace implanted electrodes in patients who are being considered for surgery. So it's non-invasive, it's less expensive, it takes less time, and we're able to measure the whole brain with MEG. MEG can also be used as a complementary to implanted electrodes. So it can be used as information to guide where to put the electrode placement. MEG is FDA and Health Canada approved for workup in epilepsy surgery. And MEG is able to detect atypical information in the brain in between seizures while the patient sleeps. And we can use that information to localize where in the brain the seizures are coming from. So this information can help doctors find the location of the onset of the seizures and also the cause of the seizures. So this is a case, this is an example of using MEG for pre-surgical mapping in epilepsy from sick kids in Toronto. So here you can see the patient on the left was recorded in the MEG laying down, sleeping. This patient had a normal MRI, but MEG is still able to localize the onset of the seizure. So the information from the patient sleeping in the MEG, who did not have a seizure, was just simply sleeping. We took that and were able to predict the location of the seizure. So this particular patient also had surface electrodes placed in the brain, and the seizure location found by MEG was confirmed with the surface electrodes. So both sources of information came up with the same location, which is what we want. So MEG can also be used to map healthy brain function, not just atypical brain function. So it can be used to map sources of motor activity in the brain, visual activity in the brain, and it can also help localize areas involved in language processing in the brain. So this information is also important when making a decision about surgery because we don't want to disrupt any important brain functions. So if we're resecting a part of the brain because it's causing seizures, clinicians want to make sure that that part of the brain that's being resected isn't critically involved in any brain function that the patient needs. So there are roughly 200 MEG systems worldwide, and specifically in the US, MEG is well established for both clinical applications and for research. So across the US, there are roughly 30 MEG sites used for clinical applications and pre-surgical mapping, and then many more research facilities across the US. So although MEG is pretty prevalent across the US and generally used often for clinical applications, it's still considered underutilized despite good evidence that it has great clinical benefits and helps a lot of people. So in Canada, we have a little bit of a different situation. There are only 7 MEG systems in all of Canada, and all of one of them are located in Eastern Canada. So there's an MEG center in Halifax, Nova Scotia at the IWK Health Center. There's also 2 MEG centers in Montreal, one at McGill and one at University of Montreal. And then there are 3 systems at Sick Kids in Toronto. Three systems in Ontario, one being at Sick Kids Hospital in Toronto, where they do both clinical MEG and research. There's also a system used for clinical adult MEG at Toronto Western, and then a 3rd system at Baycrest that's used for research. So our MEG system here in British Columbia is located at Surrey Memorial Hospital and is situated at SFU Image Tech Lab. And so it's kind of a unique situation because it is the only MEG in Western Canada, and it is also the only MEG embedded in a clinical setting west of Toronto and north of San Francisco. So it is the only MEG in a large radius and the only one that's embedded in a clinical setting, so could potentially be used for clinical applications. So we're also in a unique situation where we're one of the few labs that's co-located with an MEG manufacturer. So as Dr. Cheung mentioned, CTF is also in BC. So it's in a unique position in terms of commercialization for work being done in BC. So this is our system at Image Tech, our MEG system on the left here. It's a 275 channel whole head CTF system. So we have the ability to measure the whole brain at one time. We have the ability with this system to measure both pediatric and adult populations. So as soon as babies are born, we can measure them with the system all the way up to adulthood. So any age and a wide range of clinical populations. Also with this system, we have the ability to measure patients sitting in an upright position. So they can sit upright in this chair, their head goes into the sensor array, and we're able to measure them while they're watching a movie, playing a game, or performing a task. And our system also has the ability to rotate down into a supine or lying position. We can slide in a bed and image patients while they are sleeping or resting, which is what we really need for clinical research. So our lab at Image Tech also has another kind of unique thing about it. So we have our MEG system. We also have a 3 Tesla MRI located at Image Tech. So we have the unique ability for multimodal imaging, meaning we have more than one imaging technology within one facility. So our take-home message is we want to get clinical MEG established in British Columbia. We know that clinical MEG is validated. It helps families in the US, and it could help families here in BC. We currently have the expertise here, and we have support from local hospitals, health authorities, and universities. So everybody is in favor of getting clinical MEG established here in BC. And we're currently in the process of developing pipelines and partnering with clinicians like Dr. Dhaliwal in order to get this set up. So we know that world-leading neurology centers leverage MEG in clinical care. And we believe that this is our opportunity for BC to become a leader in epilepsy and neurology care. So in order to do this, we need support from the province, we need support from the community, and we need funding. So please get the word out there, please help support us, and let's get clinical MEG in BC so that we can help families here.